Deep venous thrombosis is a manifestation of the venous thromboembolism. It occurs majorly most of the time in the deep venous system of the body. Then there is a mechanism in the body that maintains the blood in a fluid state. That's what we call the thrombolysis or fibrinolysis system. When body sustains an injury, the cascade for blood clot formation is activated, such that a blood clot is formed and arrests the bleeding to prevent the body from losing too much blood. But sometimes there is an abnormality that occurs in the body, which leads to formation of abnormal clots. These abnormal clots are harmful to the body because most of the time they are formed in the deep venous system. There are some factors that can actually initiate formation of deep vein thrombosis. They are what we actually term as vicious triad. They include the stasis of the blood, which means the blood is not flowing as it ought to flow. It's not flowing. There is, let's say, there is the in quotes congestion of the blood. And the other one is what we call the hypercoagulability state. The third one is what we call the damage to the endothelium. When these three are activated, when these three factors occur, there is tendency that there will be formation of clots in the body. These clots are formed, then they accumulate, then leads to blockage of the vessels, most of the time in the deep veins. Then that can lead to other complications that can occur as a result of deep venous thrombosis. The deep venous thrombosis itself is not really the most feared complication of venous thromboembolism, but the most feared one is what we call the silent killer, which is pulmonary embolism. A deep vein thrombosis is a concern for the public to know about because it's a silent killer. If you have deep vein thrombosis, you may not even know. Then this deep vein thrombosis, the thrombi that are formed get dislodged from the body, from anywhere they are formed, maybe the lower limbs or the upper limb. When they get dislodged, they are carried by the blood that is flowing in the vascular system and goes to the right side of the heart. That is the right side of the heart. From the right side of the heart, they are being sent to the lung. Sometimes if the clots that are dislodged are very massive enough, they can block the airway, leading to sudden respiratory arrest, which can bring about the sudden death of an individual. Most of the time, like I said earlier, the complication of the venous thromboembolism, which is pulmonary embolism, that kills people before we even know they have it, is usually seen at when a fellow dies and this death is sudden, and people were like, oh, we need to do an autopsy to actually see what caused the death of this person. That's when you see that the person actually had a pulmonary embolism, which will be a pointer to the fact that the individual would have been having what we call deep venous thrombosis. But sometimes there are some other, in 50% of people that have the pulmonary embolism, they may have the TT signs that give them that they have deep venous thrombosis ongoing. For instance, like I said earlier, the deep vein thrombosis are usually formed in the lower extremity, although the upper extremities are not excluded. The lower limb, that's the region the lower limb, most especially the calf region, are the site for is a common site for formation of deep venous thrombosis. So if an individual have deep venous thrombosis, they may have swelling of the calf region. That's the area below the knee at the back. They may have swelling of that area. They may have pain in that area. But most of the time, some people don't even have pain. You understand? They don't have pain. They may have discoloration of the area around that calf region. And when we perform a sign, if they present in the hospital, we perform a sign that we call the Oman sign. They may actually, the Oman sign might be positive in them. But sometimes the Oman sign itself may be positive. But when you do some investigation, you see that the patient doesn't actually have a deep venous thrombosis. There are risk factors for formation of deep venous thrombosis. 1, extreme of age. Anybody above the age of 40 years is at the risk of developing deep venous thrombosis. If you are smoking, you are at the risk of developing deep venous thrombosis. Some females that use other contraceptive pills is also at they are at the risk of deep venous thrombosis, in the sense that they are the tendency of what we call having hypercoagulability state. So they are at the risk of developing deep venous thrombosis. Another one that is common to the large populace is long duration journey. If you fly for a long period of time, you know, when you fly for a long period of time, your body, you are not ambulating, you are in a stationary position. So the venous system in the venous pump in the leg, they won't be able to function very well. So as a result of that, there is stasis of the blood in your leg. So if you have other factors that predispose you for formation of deep venous thrombosis, you are much more likely to form a deep venous thrombosis. It's not only a long hours flight. Any journey that is more than 4 hours predispose you to form a deep venous thrombosis. And also, people that have cancer, because of the hypercoagulability state, they are at the risk of forming deep venous thrombosis. Any surgical procedure that is prolonged, that make a patient to lie supine, that is to lie flat on the bed for more than 3 days, we actually predispose them to forming deep venous thrombosis. Although hospital that in which their surgical procedure or any other procedure is being done would have taken a measure to prevent that. So most of the time we don't tend to see it in hospital. You understand? And some other factors like I said, there are cancer, multiple myeloma that can predispose an individual to hypercoagulability state, make them to be at the risk of formation of deep venous thrombosis. There are some investigations that needed to be done when you present at the hospital. There are some investigations that will be done depending on how the patient presents. You know, I told you earlier, and I said it earlier, that deep venous thrombosis may not be seen, though it is ongoing in a patient. And the very first time you are seeing them is during autopsy. A patient somebody just suddenly fall, and before you move the person to the hospital, the person is dead, and you say you want to know the cause of death of the patient. So they perform an autopsy, then we eventually see that, okay, the patient has a pulmonary embolus, pulmonary emboli that actually block the airway that erode the death. So sometimes we need to do some investigation to be able to know if the patient presented earlier. Sometimes they may present with the pulmonary embolism, feature of pulmonary embolism, in which the patient may be gasping for air. If they present earlier and the emboli is not massive enough to block the airway, we can actually do a chest X-ray, though the chest X-ray may not really show something much. And we do what we call some biochemical assay, the D-dimer test. The D-dimer test is not really specific for it, because it can be positive as well. That test can be positive in patients that have undergone surgery or that have some other condition going on in them. The absence of it actually rule out deep venous thrombosis, but the presence of it does not mean that you really have a deep venous thrombosis, but it is suggestive of deep venous thrombosis. So we need to do a venogram to be able to see the venous system of the patient when the patient presented, and also we need to do a Doppler of the lower limb to actually rule that out. When this diagnosis is being made, The treatment can actually be, the treatment, I will put the treatment for deep venous thrombosis in two. Well, preventive and the therapeutic one. The preventive is that when you want, like I said earlier, one of the risk factors for deep venous thrombosis is long, hard journey, either by air or by the road. When you are in traveling, that is, then you have to travel more than 4 hours, try as much as possible not to sit, try as much as possible to move your lower limbs as you can. You can flex and contract your ankle joint. By so doing, you are exercising your calf muscle such that it will help with the venous pump in the calf to help to return the blood to the heart and prevent blood stasis in the lower limb. You can also, when you come back from your journey, you can do a minor walk around. Maybe you have a stopover during your flight, you can walk around. By so doing, you are activating the venous pump in the leg. When you have a stopover during your road journey as well, instead of just sitting down in one position again, take your time to walk around. By walking around, you are contracting the muscle in your leg, and that will help with the venous pump. But that will help with the venous pump. And as much as possible, if there is no need to take oral contraceptive pill, try as much as possible to avoid that. There are some other factors that we may not be able to do something about, like your age. There is nothing you can do about that. You can stop smoking as much as possible. Smoking is dangerous to your health, you know that. So you can stop smoking. That will help you to reduce your factor. That's a preventive one. But in a case whereby it has been established already, we definitely put the patient on anticoagulation therapy. You put them on anticoagulation therapy. That will be done in the hospital. After the series of tests has been conducted, we put you on anticoagulation therapy. And there are some other things that can be done as well to actually remove the emboli. We can do some surgical procedure to remove the emboli that is formed in the lung if it has not completely occluded the airway to bring about sudden death. There is nothing you can actually do for a dead man. And we can put some device in the, you can put some device as well in the inferior vena cava to help to sieve the blood clots that are formed from the lower limb from getting into the heart, thereby ending up in the lung, that it will bring about problem. Thank you very much.